Hello, Lemonsterites. This is your state representative, Natalie Higgins, and this is our November episode of Representing Leominster. And unfortunately, you're still stuck in my home office. I'm hoping that you're all healthy and well, and that you all have wonderful Thanksgivings. And I'm so thrilled to be joined with one of my closest friends, Jack Patrick Lewis, who is the state representative in Framingham and Ashland. And we just finished our House budget week, a few months delayed. And I'm really excited to have Jack on just to talk about one, how it's been for the last 8 months doing our jobs remotely. Normally we're in the chamber and getting to do a lot of work together. It's been, I will say, a lot harder to connect with my 159 other colleagues in the House and be able to do the meaningful work to get important legislation done. And unfortunately, it looks like we're going to have another remote budget. So, Jack, just for folks who haven't had the pleasure of meeting you, you've been to Leominster a couple of times. And can you give a little bit of your background? We both got elected in 2016. We came in together and just tell the Leominster viewers a little bit about your path to deciding to run for state rep and what you've been working on in the last 4 years.
Excellent. Well, thank you so much, Natalie, for that introduction. Professionally, I'm an ordained minister by background. I served a Unitarian Church in Wellesley. Got that job about 10 years ago now. And like Natalie and like many folks, professionally, the last 10 years have been an interesting roller coaster that have taken me to places and to jobs that I never imagined possible. Uh, After serving at the congregation as an assistant minister for religious education and social justice, I left to be the executive director of an LGBTQ youth group that started out as a small gathering of area teens, but by about 6 years ago was large enough to become its own nonprofit, and leaving the church formally to lead that nonprofit was an enjoyable experience and an opportunity to continue to learn new skills, which is actually where I met Natalie. We
Mhm.
met at a workshop on, was it budgeting?
Nonprofit budgeting. Yeah.
Yes. Uh, and so I, parallel to all of that, got very involved in my local community, got married, adopted our first son, and got involved in other people's campaigns as a volunteer. Got involved in our local Democratic town committee. Uh, and I remember it was the Tuesday before Thanksgiving when I was looking through my phone, laying in bed in the morning, as many of us do. I grabbed my phone and just start going through social media. I read that our wonderful state rep, Tom Santacandro, had announced that he wasn't running for reelection. And so I immediately started wondering if this were my opportunity to explore the possibility of running. And I think, like Natalie, I took the next several weeks and months to have those important conversations with my family, with friends, with community leaders. For me, all of those conversations started by me saying, okay, bear with me. I have a crazy idea that I need you to talk me out of. And every single one of those conversations ended with the person saying, you have to run. I'm supporting your campaign. When is your kickoff? And so since then, I've loved serving with Natalie and our colleagues over the last 4 years in the Massachusetts House, and working on a variety of topics from animal welfare to accelerating our transition to renewable resources, and most recently, co-chairing the House Progressive Caucus.
So that's a big deal, right? In your first 4 years that you have risen to co-chair of the Progressive Caucus. And I'm so thankful to get to work with you and work on how do we make sure that we're working on issues that are relevant to people across the Commonwealth, and really lifting up the voices of working class communities like ours. You represent Framingham, I represent Leominster, making sure that those voices are represented in all of the discussions that we're having at the State House. Can you talk a little bit about what has been different for you with COVID. I think for the first few months, a lot of us were just trying to figure out how do we continue to do our job and connect with our constituents. But now we're 8 months in. Are there any lessons learned, any things that surprised you over the last 8 months?
My gosh, it's been 8 months already. Uh, well, one thing immediately is that uh, getting to know you and other members of the Progressive Caucus have been an essential part of the last 8 months. I hope your constituents all know that you are the hardest working state rep. I am saying that knowing that my constituents are also watching, but what you do goes above and beyond what anyone else does. And even when I put in a long day and fall asleep with my computer in my lap on the couch, I know that you're still awake, working and doing this important advocacy for our constituents. Uh, because as you know, there's so much to be done. And as a state rep, uh, people often wonder what we're supposed to do and what our job responsibilities are. Overly simplistic explanation: we pass legislation. Uh, but as you and I have realized, that's such a small part of the work we do. Helping our constituents get access to state services is a much bigger part than anyone seems to ever talk about. And with COVID, that has, at least for me, become about 90% of what I do. Uh, Hundreds and hundreds of people having issues with unemployment uh, and helping to organize their cases and reach out to the appropriate folks. I get text and Facebook messages
Mhm.
and emails at all hours of the day over the course of the weekend. Uh, and as you do, we try to keep track and make sure that if our constituents are entitled to services, that we find a way to make sure they get those. And I think that has been the biggest change for me, is that that used to be about 20% of what I did, and it is now nearly all of what I'm able to do in my time. Uh, the other piece is that we're all figuring this pandemic out as we go. Uh, the image of building a plane mid-flight is one we keep hearing, but what we have done as a progressive caucus and as well-connected members is that we have had more meetings and conversations than ever before. There was a time, I think in the first 4 months of this pandemic,
Daily
where
meetings.
daily meetings for an hour, 5 days a week, uh, in which we shared emerging best practices. We've pushed our local leaders, we've pushed the governor uh, to do more in the face of this pandemic. And I can't imagine having done the last 8.5 months of this work in the midst of this pandemic without that close knit group of colleagues uh, and each of those morning calls to share what we're learning in our own communities, what's working and what's not working. And I'll say for me personally, I have taken a lot of time over the last 8.5 months to rekindle friendships with friends and colleagues abroad and across the country as well, because we're not in a vacuum fighting COVID-19.
Mhm.
And so as soon as COVID hit and cases were bad in Spain, I was in very regular communication with friends and colleagues in Spain, and then Australia and Asia, to learn what was working and what wasn't working there, to get a little bit more behind the scenes of what we read in the paper, uh, to see what we could implement here in our own towns, in our own Commonwealth. Uh, and while I'm hopeful that we'll turn a corner one of these days, the increase in cases makes me that much more confident that we need to continue these conversations. But Natalie, how about you? Was your experience over the last 8.5 months parallel to mine?
Absolutely. So welcome to the club with constituent services, because that has always been about 80 to 90% of what we do. Because there were a lot of gaps to access when it came to fuel assistance, food assistance, unemployment, so many other programs, healthcare access, right? We have a global pandemic where folks are losing their jobs and losing their health insurance. So that has been another major issue that we're trying to connect folks with. Mass Health and the Health Connector when they need it, so that they can have that continued coverage in the case that their families need healthcare access. Um, so really trying to figure out how to also continue to connect with Leominster residents who are struggling. And I think that we've done a really good job. And I think many of our colleagues, including especially you, um, because you're getting those Facebook messages, right? Like you're getting those texts. And we used with those morning briefings, those calls to kind of pull together all that information, because it was things were changing by the hour at the beginning of this pandemic in terms of the resources that were available, the issues that were popping up, to really put that information out on our social media and try to find the ways to connect um, with our community members, but also knowing that not everyone is on Facebook or Instagram or Twitter and are getting those messages. And how do we get that out? So I still have a monthly column in the Leominster Champion, but that paper is available in a lot of the places that have been shut down or available only by appointment. Um, the issue that Isabel and I had really started to dig into locally was homelessness in our community and making sure we had adequate services. And then COVID hit. And we have so much more work to do. I'm so thankful for all of the groups that are doing work in this space and helping me learn so that I can do better and learn from the work that they've done before. But we need a better system. We still don't have a place where someone who is experiencing homelessness can drop into and get shelter, right? Like that basic need that when you talked a lot about traveling, your connections internationally, and you and I both took trips, you to China, me to Taiwan, kind of less than a year before this all happened, and to be learning from our colleagues there about how they're responding to this and how they're reacting to this, how they're using in Taiwan a mask mandate, and something that as a country, all of their residents were much more comfortable just jumping into, but it has proven unbelievably effective in preventing community spread. Most of their cases are coming from travelers who are traveling outside of the country and coming back and quarantining once they get back. But with the holidays upon us and our numbers quite on the rise, I'm really nervous about how do we reduce isolation. I don't want anyone feeling more isolated than they already are, but at the same time knowing that a lot of the spread that's happening in Leominster and Fitchburg right now are from small gatherings. There aren't these super spreader events. There was one with a church, but a lot of the spread is happening through small gatherings where maybe we're letting our guard down. We want to see our friends and family. It's cold. We don't want to stay outside anymore. So it's okay to have a few come into our house, but that's where the spread is happening. So remembering to practice social distancing, wear your mask, keep that contact as limited as possible, because we got to get through this and we got to get through this together. Um, and I'm so proud of all of the community projects that have popped up to provide masks, right? Like the home sewing of masks. AIS is doing the mask challenge and equipped a lot of our first responders in schools with masks. We have some really phenomenal community members who are making desks for kids who are now doing a lot of remote learning, even if they're in the hybrid model. A lot of time at home to make sure that they have a workspace. So I'm so proud for all of the ways that the community has stepped up, but unfortunately we're in this for many more months. It's been 8.5. It's going to be probably another 5 or 6 at least. And we got to figure out how that we can continue to be vigilant about this. And continue to get that information out here so we can make the best informed decisions to keep those we love around us safe.
And I get
How
it.
is
People. Oh,
I was going
sorry.
to say, how is it going with school in Framingham? I know Framingham decided pretty early on to stay remote because of some pretty massive outbreaks in the community. How are you have 2 kids who are navigating that and you're helping them. How is that going?
It's the fact that we haven't heard any of them over the last 15 minutes is
It must be going
miraculous.
great.
It's going great. No, so I get it. We're all sick of this. We're sick of the pandemic. It was so last spring. The We've been asked to do so much,
Mhm.
and going into winter, it's cold, and to be inconvenienced and separated from the people we love. any longer. It seems to be asking too much, and but lives are on the line, and we have to steady the course. I think with education, uh, it's also an example of for many of our communities that are in the red or were in the red or will soon be in the red. Uh, it, Going back to school isn't as simple as uh, telling half the kids to come in one day and then hiring people to scrub things down and then hoping that the teachers are able to do everything they usually do, but now both virtual and in person simultaneously. Uh, there's a lot of assumptions that go into reopening plans. Uh, and I get it, it's hard. Both of us here, my spouse and I, have full time jobs. And so we're trying to keep up with things and do conference calls nearly all day, it seems, all while our second grader is learning to read. And his day is 70% in Spanish. So he's learning to read in a language that he doesn't speak fully. And it's hard. And there's a lot of stress and a lot of anxiety. But I know that our home's not alone. But the alternative is, for us here in Framingham at least, asking our teachers to return to an environment that, in my opinion, and the opinion of most medical and scientific experts, just isn't ready to welcome them back. And I understand the stress and anxiety other parents are feeling. I get the emails. You have no idea how hard it is to teach a second grader to read via Zoom. I do. I'm living it every single day. And I think I'll go as far as to say that I think our governor has done a disservice to this conversation, uh, touring affluent schools with seemingly unlimited resources and praising private schools with great resources as shining examples of what we need to what all of our districts could do and should do uh, is setting up unreasonable expectations for many of our communities, and it only, in my opinion, uh, aggravates and brings those emotions to the surface in a more pronounced way. The feelings of all parents who want to get back to work, they want to be able to do their jobs that they love, and they want their kids not to fall behind. Uh, but it's not as easy as flipping a switch. Uh, and so I just implore families and community members to continue to remember that if we're going to say we're all in this together, then we need to actually act like it, and that the increased cases, as Natalie has said, are small gatherings in which we think, oh, it's just another family. We're doing our own little pod today or a little bubble, but that's never the case. And this disease is deadly. It spread easier than we first imagined, even in March or April. Uh, and I know we're asking so much of people, but we need to, for the sake of keeping as many of us alive on the other end of this pandemic as possible, just continue to implore people, follow the scientific guidelines, uh, postpone events. And if we look to what other countries have done, there is a way to come out on the other side. Uh, it just will require great intention.
Yeah, you brought up two things that I've been thinking a lot about is one that I hope a silver lining of everything that we've experienced is that we can have a real conversation about universal childcare, that so much of our economy hinges upon our public school system kind of masking that need. And we were really confronted with just no network of childcare providers for families to plug into. And I know in my community, not only are the wait lists incredibly long for childcare access, it's incredibly expensive. And for a single working parent, childcare can cost 60% of their average wages, right? That's just a system that doesn't work. And if we want an economy that's really strong and robust and everyone to be able to work, we've got to make sure that they have childcare. And it sets up our kids, especially in gateway cities where maybe we haven't been investing the money we need to in the education system, it sets them off on a head start. Reason why they call it some of the programs that, but it gives them a jump start to their education. And our early educators are the heroes among us for navigating and being able to provide that and continuing to try to do that as safely as possible during the pandemic. Um, the other piece is just how do we continue to support each other throughout all of this as the data is changing, as the numbers are changing. And I have shared my frustrations with the governor that as the metrics seem to show that there is a lot of spread in our community and a lot of COVID cases, the metrics change and oh, we're going to change a different way than we show these red communities. So instead of 170 red communities, we only have 17. I think that that is adding to the distrust of government and the data that it can be changed so quickly to fill the narrative that you need. But while we're filming this in the middle of November, our hospital capacity is at 70% of our COVID beds, and our ICU capacity is at 50%. Worcester is going to have its first field hospital reopened because we're going to need it very soon. And that is a frustrating place to be in when we had the spring and we had the summer to be able to learn how to do this better, how to protect our frontline healthcare workers, and how to make sure that we need this. And I heard reports that Doctors Without Borders are coming to the US because this is one of the biggest healthcare crises globally. And for a country with as many resources as we have, it's hard to imagine that we are in need of those resources right now and that we're taking that help where it probably is needed in many other countries as well.
Oh, I agree 100%. Uh, and I think the field hospital is a perfect example of we need it. I'm happy the governor is doing it, but in doing so, there's an acceptance that there's nothing we can do. That this is a wave that is coming no matter what, and get to high ground and hopefully you know how to swim because it's going to hit us, which is not the case. And I worry even the imagery of waves implies something beyond our control. Our choices have created this wave, and our choices continue to create this wave. And if everyone in our communities today chose to do things differently, there would be no increase in this wave. Of course, there are cases out there right now we don't know about. There are people who just became positive with COVID. But what we've seen in other countries is that when there is a outbreak, this morning I was reading about a small outbreak in Australia, and they're just doing a freeze of 10 days in the area. We're going to stop. It's going to be hard, but the alternative is we lose control. And once cases are spreading the way they are now in the community, where it's nearly impossible to do contact tracing because the community spread is so wide, that the only way to bring us back to sensible levels is to reflect on some of those major difficult decisions we implored the governor to do all those months ago. And I join you in being extremely disappointed in our lack of ability to provide what's needed to folks. I love that, as you have said, community members have stepped up and made masks. I have met all of our masks are homemade masks from community members, but that shouldn't and can't be an essential assumption in government policy. It's the community getting together for a quilting bee isn't the solution to smallpox. And with our government, with all the resources we have, acknowledging that we have lost more Americans to this pandemic than many of the wars we've ever fought, and then you compare the resources we've put to fighting this pandemic compared to the resources in fighting those wars. There is no reason that we aren't mass producing N95 masks. There is no reason that nurses have to wear the same mask all week, cleaning it with hydrogen peroxide.
Mm-hmm.
You can look at conversations with grandparents and great grandparents to hear of the sacrifices that were made during World War II in particular, uh, makes it so clear that when a country acknowledges that we're truly all in this together, that we all then make sacrifices, including financial sacrifices and sacrifices of our own personal choices for the better good of the country. And I'm not seeing that at the levels I expected. Uh, and we're just going to see more and more deaths. Uh, and and that's, disappointing is not the right word. I think we're all going to be asked by our kids and grandkids, what we did in the great pandemic of 2020, and we're all going to have to give answers. And I hope folks make make the best choice with all the whatever pressure gets them there, because we're not all going to get through this. And I just keep imploring our governor and our local leaders to make the difficult choices that no one wants to make, and to implore folks to take care of themselves and their loved ones by doing what we know we need to do. Uh, I can't wait till you and I get back to talking about something other than this pandemic. Your state rep Natalie is taking the lead on so many things, and is just well respected in the state house and across the state. And while she acknowledges that 90% of her work is on constituent services, that other 10% shines above and beyond what most of our colleagues do. And so you're lucky to have her. She responds and gets back with folks, even folks who don't share maybe any of her political views, and has those difficult conversations, which is exactly what folks look for in an elected leader. And Natalie, it's an honor to be your friend, to serve with
I
you.
need to have you on my show every month. Like, this is so great. But Jack, right back at you. We work with some really amazing folks. Uh, this has been an incredibly difficult last 8 months trying to figure out how we can better support our communities, advocate from our homes, which this isn't the most effective way to be a legislator when so much of our work is relationship building and talking to folks. We have a whole new group of legislators coming to join us in January, and it's going to be incredibly difficult building those relationships that are so integral um, to our work. And I'm glad that we got a House budget done. That it looks much better than we could have anticipated, but there's still a lot of need. We're seeing service cuts to the MBTA and the commuter rail, to our RTAs. There, no matter what we're doing, there is more need to make sure that we have all of the support services and public goods that we need, and our education system is trying to do everything that it can to provide our kids an education in a format that it was not built to do that, and keep everyone safe and healthy. So, you know, we're we're in November. It doesn't look like we're heading into a good space. And I'm just hoping that for everyone who is struggling right now, whether it's unemployment, food access, you housing, you just don't know. We didn't even talk about the eviction moratorium being lifted. Like, there's so much that Jack and I could have talked about that is incredibly frustrating and heartbreaking that our community members are having to deal with. If you know anyone who is facing an eviction now that the eviction moratorium has been lifted by the governor, please reach out to our offices. We can connect you with resources. There is new funding available. We're trying through the budget to increase that funding, but we've got to make sure that you know all of your rights, and that you have all of the support systems and support our smallest landlords, right, to make sure that they can continue to own their and maintain their property and provide housing for so many of our community members. There's a lot of work that we're balancing, but we don't want you to be out there alone in this, and our office is in any way that we can kind of take something off your plate, take something off your shoulders so that you can be there to support your loved ones. We want to be able to make sure that the state government is working for you. And that is, for me, always been kind of the number one thing that we can do is make government more accessible. It's supposed to work for you. You're supposed to be able to trust in it. And that's one of the things that we have a great privilege to be able to do. So you can always reach out to me. My contact information will be on at the end, but we're still doing our office hours virtually. There's so many ways to get in touch with us, whether it's phone, email, social media. So many of you reach out that way. Phone and email is best because we don't always catch the Facebook messages because they keep changing the ways that we get them. But I know for Jack as well, he just wants to make sure that you're getting access to all of the services and that you're not experiencing as much hardship as you're experiencing right now because we're all going through so much, and we want to make this process as easy as possible for you all. So, Jack, thank you so much for joining me. 30 minutes goes by fast. And to the Framingham viewers, cannot wait until I can come and visit you again, hopefully uh, sooner rather than later. But for now, we're doing what we can to stay home, wear our masks out in public, keep social distancing, stay to our family units, because we want to make sure that we're slowing down this spread and protecting each other. So thank you, and we'll see you in December.